very much. A reminder to media on the line, please press *1 to enter the queue. You'll be limited to one question and one follow-up. Our first question comes from Justine Hunter, Globe and Mail. Justine, are you there? Okay, we'll move on to Richard Zussman, Global News.
Dr. Henry, excuse me. Dr. Mark Lefishin did a presentation yesterday to Coastal Health. Excuse me. And part of it, he said, we do have a number of health orders that were put in place, and they were put in place largely because of uncertainty about what would happen about Omicron. And now that we are certain it's less severe, they will have to be stepped down. So first, is it responsible for somebody in a position like Dr. Lefishin to be saying that health orders should be lifted soon, considering we are not even at the peak of hospitalizations left? And how should people read this? Should we anticipate that next week you will be easing those current restrictions that are in place?
Yeah, so I think from the very beginning, and I talked to my public health team, of which Dr. Lefishin is one, pretty much every day, but formally about 3 times a week. So I think the presentation he was giving to other healthcare workers reflects some of that discussion. And we have always, from the very beginning, tried to put in, as I've called it, the least restrictive means, trying to do what we need to do based on what we know. And I talked a little bit about the factors that we look at going into those orders. And yes, absolutely. In December, when we were looking at this curve going up, and there were so many unknowns, that we needed to take action that would protect our healthcare system as much as possible and account for the worst case scenarios that could happen. And we try and do that in a measured way, and finding that balance between not interfering with societal the things that we do in society that are so important for us, including the economy. I mean, people working is important, people going to school is important. So it has always been about trying to find those balance. And I, as you know, made those orders come up for review on the 18th. And I gave you some sense today of where we are, and we are in the process of looking at what is it that we need to do and what can we do to change these things and look at the restrictions that are in place and are they needed anymore. And I'll have more to say about that on Tuesday.
Richard, do you have a follow-up?
With some of the data you presented here around severity, we are seeing in some cases, many people in this province are making different decisions. We are seeing some people make the decisions that they're going to get on with their lives and they may get COVID and hopefully not end up in hospital. Are you worried at all about a lax attitude towards Omicron and people making decisions that could lead to problems? And just if you could, and for Minister Dix, we've seen this example where a hockey team in Burnaby traveled to Alberta to play in a tournament because there are no tournaments allowed here. Is that okay to do that, even though it's not against the rules and basically an indication that they're not particularly worried about, risk and there could be, COVID cases now linked to that travel?
Yeah, so I think, I'm disappointed to hear that because we made it very clear that tournaments are a source. And, look at the information that I presented. Those are places where people come together over a longer period of time, et cetera. And so it's not surprising to me that there are cases related to that. I think what I've been trying to say is that we need to look at risk. And for many people, the experience that they have now, we've seen a lot of people with COVID. There's everybody at least everybody I know knows somebody that has had COVID now, which is different from even in November when Delta was circulating in our province. So it has changed our thinking, and for many younger people who are highly connected, who are vaccinated, it's not been such a big deal. for many young people, including some of the young people in my life, it actually has been a big deal. They may not have ended up in hospital because they're vaccinated, but they've been feeling really lousy, and it's not a nice thing to be sick with this virus. So there is a balancing of those risks. What we're saying is, yeah, we need to get on with our lives. We need to move through this. We're in a challenging time right now. We're learning more about this. There are some people who are still more likely to get severe disease. And if there are people in our families, in our communities, we need to support them and help them through this period of time, and particularly older people, people who have underlying illnesses. So that part is the same. Even if you're vaccinated, if you're over 70, you need to take some precautions right now. It's not the time to go into large indoor group settings. Give yourself another few weeks for us to get through this wave. If you're somebody who's going through cancer treatments, we know that you've always had to take precautions, COVID or not. Prior to this pandemic, people who are going through cancer treatments had to be very careful around, especially during respiratory season, because a virus can cause severe illness regardless of your immune system and the amount of vaccine that you have. So we all need to think about those things in our situation right now. And we're trying to be able to adapt to what we're seeing going on right now in our communities. So we do have a period of time that we're not yet there. We're going to have a tough time in our healthcare system, and we talked about this because healthcare workers are getting sick enough that they cannot go into work for a period of time. So if you have an elderly relative who's getting home care, you might need to call them and support them right now. They might need some extra help from family and friends during this period of time because of resource constraints. So it is us moving to trying to get on with our lives, to interrupt society as least as we can. But we're also, recalibrating and adjusting as we're learning, as we're going right now. And Minister?
Thank you. I think I'd just say two things, that Dr. Henry and Public Health brought in new measures on December 20th, on December 23rd, on December 29th, and December 31st. And I know because I watch this obviously closely, and we're in multi-daily contact with everyone and teams working together between health systems and public health, what they go through when they make those decisions, understanding that they have impacts on other people when you put in place restrictions. And so when those decisions, and I think the balance in British Columbia
between restrictions and what people can do has been really clear-sighted, a full understanding both the impact of COVID-19 and the impact of potential restrictions. So if you ask, are restrictions being reviewed? They're reviewed every single day by public health, discussed every single day by public health, and have been for months and months and months, whether it's in the impact on long-term care, and that impact can be profound. I can tell you that personally, how profound it can be. The second thing I wanted to say is that, we announced some weeks ago in advance, right? Not because we needed to on that day, but in advance, that we were delaying and postponing non-urgent scheduled surgeries. An enormous decision, a huge sacrifice for the individuals involved. So when people talk about sacrifice and getting on with life, the biggest sacrifice is being made by the people who provide that care, but more importantly, the people receiving surgery and their families. That is a massive sacrifice. Surely more important than being able to go to Alberta to play in a hockey tournament. And I think that we have to put it in context, how seriously we take it, and how sometimes you have to bring in measures and orders in advance before they're effectively needed in order to make the changes that are required. I'd say with respect to that, I'm not, there's a tendency, I think, to point fingers at people. The people involved there who probably are dealing with COVID-19 now don't need to be told it or scolded or anything else. Not at all. I mean, when people, we all make mistakes all the time. And I don't think we need to dwell on it. But what I said is at the beginning, Richard, is the most important thing. COVID doesn't listen to us. It doesn't argue to us. It doesn't listen to our excuses. It doesn't say, okay, this is a way around the rules. It lives to transmit. And how we respond to it reflects who we are as well and what we care about together. And I think the people of BC, their response to the booster campaign, everywhere I go, their response and the way they treat people in public places, everywhere I go, the support they give to one another, the work done by teachers and workers in grocery, the work done by healthcare workers, this is inspiring. So there are no lectures to give. Start today. If you made a mistake yesterday, start today. If you haven't got vaccinated up to now, get vaccinated today. Book your appointment. So let's not talk about what people could have done yesterday. Let's talk about what we can all do today, and not offer lectures or lessons to too many people all the time, to focus on what we can do today to help one another during these really challenging 2 to 3 weeks ahead of us.
Impressed.
Hi, Dr. I was wondering if you can tell me how accurate will the modeling data be now that with the Omicron variant affecting one, and
at the end, how accurate is the Omicron modeling, or is the modeling given Omicron? Is that
given because of how Omicron is affecting everyone? I mean, how accurate is the data given through modeling? Because until now we've had pretty good estimates of where we are, but with Omicron affecting everyone, how accurate is this data now given through modeling? And what is next after this?
Yeah, so models, I've said this many, many times, models are always dependent on the inputs, what you put into them, the parameters that you use. And that's why all models are different and all models are wrong, but some of them are very useful. And so, yes, we've been working with our modeling team. There's several modeling teams across the country. And that's why we try and do things, look at the same picture with using several different methodologies. And what you'll see is we didn't present the reproductive number because that is not something that is robust with the data that we have right now. But what we focused on is hospitalization and the new admissions to hospital. And that is robust data. It's robust data given what we know about our hospital system, about who's being admitted, and also about things like we can have a pretty good estimate of transmission rates in the community, an estimate. We also have a pretty good estimate of things around booster doses and who's got them and stuff like that. So there are many, many different caveats and what we call sensitivity analyses that are done with these models. And our team at BC CDC, and Mike Irvine and Jat Sandhu and Michael Otterstetter and our team at BC CDC have been immersed in this for 2 years now, and Kate Smolina and the team. Anyway, there's a whole group of them who look at all of these different parameters. So accurate, they're never a prediction. What they are is a set of scenarios that we can get a good sense of what might happen. So I am confident in them. You can see if you look at the model that we've presented with Omicron, taking into account all of the things that we've learned about incubation period and length of stay and all that stuff. And you can see there's a whole wide shaded area. And that's important. That tells us the sort of universe of what could be the true the true path or the true pattern. So these are all things that help us. It all has to be put in a context as well of values and preferences and choices that we make in judgments. So it is really important, and we've been working with these models since I presented the first one in March of 2020. So none of them are a prediction or accurate in that sense, but they do help us understand the trajectory. And I am confident in these models that we're presenting, helping us understand what's going to happen in the next few weeks. In terms of what's next, in terms of this pandemic, I think we've seen such a dramatic change with the change in the virus in Omicron and such dramatic spread that we now have a level of, excuse me, combination immunity from both Omicron but also vaccination, that I do think this is a step closer to us living and the virus becoming endemic in our in our community over time. What we don't yet know is how those patterns are going to look in the coming years and how much change we're going to see in the virus in coming years. So how long our booster dose is going to be protective, whether we're going to see it follow other respiratory viruses and be worse in the winter and the summer, or whether we're going to see it bimold. So there's many things we don't yet know, and I think the WHO made that comment, and it's not influenza yet because we know a lot about the patterns that influenza undergoes. But we're getting there, and I think this is a big step towards that.
Hina, do you have a follow-up?
I do. I was also wondering, Dr. Henry, how many homeless people are affected by this new wave, and do we have any numbers on them, and how are we tracking them? And isn't it especially important that we track them because they tend to move, so they are both at a higher risk of acquiring.
I'm sorry, can you maybe try and speak closer to the mic? You keep breaking up and it's difficult to hear. I think what you asked was about people who are homeless, or...
Yeah, I'm having a problem with my phone. I was wondering if you can tell me how many homeless people are affected by this new wave, and do we have any numbers, or why aren't we tracking them? Especially since the segment of population tends to move around a lot more, so they have a higher chance of both getting the virus as well as spreading it.
Yeah, so a couple of things. We don't actually... we do support people who are homeless in a whole variety of ways. And one of the things that we focused on from the very beginning is making sure that we have resources in place for people who are homeless for testing. That's something we started very early on in a number of communities. And also prioritizing people who are homeless or underhoused or living in shelters for vaccination. So that is something that we've done in many communities around the province. And we've been working with the communities, the downtown east side. We saw quite an increase in numbers of cases during Delta in the fall, in that community in particular. And we're monitoring, we're not seeing huge outbreaks in that community right now, and the kudos go to the teams who are working in the shelters and the supports in places in the downtown east side, and our public health teams and the community nurses and the outreach nurses who are the outreach teams who are supporting people in those communities. So we are not seeing a tremendous impact in people who are homeless in different communities around the province, more so than any other community, and we are obviously trying to make it as easy as possible for people to get booster doses and second doses and first doses in that community again too.
Next question, Gordon Hoekstra, Vancouver Sun.
Oh, thank you. I wanted to ask a question around the restrictions and the possibility of them being lifted or being reviewed on Tuesday. I mean, given that the next 2 or 3 weeks are going to be challenging, what exactly do you have to see in order to lift or reduce the restrictions on Tuesday?
Yeah, so those are ongoing discussions that we're having around the different aspects. So there's, as you know, different things in place in different parts of our community. I think you will see that the COVID safety plan structure is going to stay in place for some time. So those are ongoing discussions, and I'll have more to say about this next week.
Do you have a follow-up, Gordon?
Yeah, I'm just trying to get a sense a little bit on the hospitalizations and the healthcare workers. Are we at a point where the number of staff sick are impacting the ability to care for people with COVID or other people in the hospital at this point?
Minister, it's probably best for you to answer that.
I think it affects in a number of ways.
Obviously, the number of people who walk in with other conditions with COVID-19, and Dr. Henry has spoken about this, affects things such as the cohorting we like to do in hospitals and have been doing, essentially separating the population testing positive for COVID-19 when there's more people in the hospital. And look, let's be clear. You start with, you have about 10,000 more healthcare workers off sick than the same period last year. That has an impact. And it has an impact in hospitals, and we've made adjustments for that. That's why we decided well before Christmas, the week before Christmas, to take the steps on non-urgent scheduled surgeries. That involves, obviously, thousands and thousands of people every day of healthcare workers, so that we're able to redeploy and also redeploy and support immunization, which we've been doing as well. So yes, it affects it. And in particular, Gordon, I think it affects it with respect to services that are provided, not so much in the hospital, although it has profound impacts there, but also in the community, in every long-term care home that's facing an outbreak. Because when an outbreak protocol, there's lots of talk about visitation, but when outbreak protocols are announced in long-term care homes, they have really profound impact on other activities, including social activities within the care home that are important to the lives of residents. And equally, in other services in the community that are critically important, we have smaller numbers of staff people providing those services. So yes, the level of COVID-19 has an impact. Yes, we have taken very strong action to deal with that. And yes, those actions are reviewed every single day because they can affect a facility in a small town in that day, and if it's Interior Health or Northern Health in that case, or hospitals as large as Vancouver General and Surrey Memorial Hospital, the same. The short answer is yes, it affects the healthcare system. But I want to encourage people, if they need to go to hospital, if they need care, to get that care, that our healthcare workers continue, 188,000 of them, to provide outstanding care, and there will be some need from patients. Our teams are working, and we're putting plans in place if the situation worsens or is worse in some places, to make adjustments both regionally and in every and across every part of public health care. So yes, it affects it. Yes, you can't have more people off sick and it not affect the amount of care you can do. And that's why we're taking action under our surge plans every single day to do that. Our administrators, who have formidable work under these circumstances, are frequently now, both at BCAHS and everywhere else, working at the front line as we supplement and try and support our staff teams. I want to thank everybody from at every level of healthcare workers, members of the HEU, the HSA, the BCNU, our administrators, members of the Doctors of BC, members of the BCGU, many other unions, the UFCW, many other unions who are involved in healthcare, and the workers who are members of those unions who are making such a huge difference today. And we're just going to continue to work every day, and we're going to have to make adjustments, sometimes several times a day, to make sure that we support the most urgent care.
Next question, Rob Buffum, CTV.
Oh, hi. Thank you for taking my question. My first question is on behalf of a colleague, and it relates to long-haul COVID. They're wondering, in light of the fact that the province has been discouraging many people from getting a PCR test, unless you're in, a vulnerable group, what do you say to folks who are getting long-haul COVID, or maybe in the future, who need to and are unable to work and need to bring in a WCB application and don't have proof that they were, diagnosed with COVID because they didn't get a test?
Yeah, this is it's a reality that we're facing right now, that there just is not a PCR testing available for mild people. For mild cases, and I will say that we are still trying to understand whether Omicron leads to that type of long-term complication as much as other variants like Delta in particular. I've also been talking with our clinical care team with the long-haul clinics that we have, and there are other ways of being able to determine if somebody was actually infected with COVID-19 once they have symptoms down the line. So not readily available tests, but you can do serology and a few other things. So we're working out how to manage that, and the same goes for working with WorkSafe around worker compensation issues. But, the bottom line right now is we just don't have that testing capacity, and for many people a rapid test is what they need, which will be more available. So those are all challenging things that we'll have to work through, and we're not alone in that. This is happening everywhere. So being able to determine if people have ongoing symptoms related to a COVID infection is something that we can do post hoc, as it were.
Rob, do you have a follow-up?
I do, and it's sort of a double-barreled question. I'm wondering, in light of what we've heard today about cases peaking or already having peaked, hospitalizations likely to peak in the next couple of weeks, natural immunity from Omicron spreading, as well as we'll know there'll be more vaccines and boosters in people's arms by February. Can you give us a sense? You've talked about this being a big step towards it becoming an endemic. What might the end of February, March look like? Could this be the sort of the rosiest time in this pandemic yet? And I'm hoping you might be able to give us a clue as to what we'll hear on Tuesday. Are there going to be any restrictions that may get lifted or modified in relation to gyms or otherwise?
I'm going to defer the Tuesday question to Tuesday, but I do think I think this spring we're going to be in a different position across Canada, across North America, across much of Europe. The caveat that we have is that this virus continues to change and modify itself and surprise us in many ways, persist as well. So until we globally have that level of protection, we are still at risk of something else arising. So there are still those concerning caveats, and as I mentioned, we don't yet know what the patterns are going to be of this virus circulating in our communities. Is it going to be like other coronaviruses that eventually become another cause of the common cold for most people? Are we still going to have more severe illness being caused in certain populations, and which populations are there? We have a pretty good idea probably of who they might be. But those are some things that we're going to work out over time. But I do think this is a real transition in our moving out of the pandemic and learning to live with this virus. I think, I've said this for the last 3 years, but if we make it to Easter, I think we're going to be in a really different place. And yeah, I do think we're going to be able to put aside some of the things that we've been having to do on a regular basis. And it goes back to how I've tried to talk about these things. The many layers become more important when there's more virus, the more transmissible, more risk in the community. So like last summer when we had very little virus, things like mask wearing in every situation were less important if we kept a respectful distance from people and, did all of those other things that try and make sure we weren't putting people at risk. So it's going to be a transition. It's not going to be an abrupt change. I think a transition as hopefully this virus will settle down in our communities over the next little while.
Next question, Justine Hunter, Globe and Mail. Justine, are you on mute? Okay, failing that, we have time for one more question. We're going to move to John Hernandez, CBC. John, please go ahead.
Hello, good morning, everyone. Dr. Henry, you mentioned children with mild illness can return to school when their symptoms have resolved. Why do you think there's still some confusion around that? There's also seems to be a bit of confusion around whether children with no symptoms but with COVID in their household can go to school.
Yeah, there's confusion because it's a change. And it's a change to adapt to the situation that we're in now. And it really is, making these recommendations in real time, given what we know. And we know there's a lot of viruses circulating right now. So and we know that access to testing is limited. So the best advice that we have right now is that if your child is ill, keep them home from school, from childcare, and when they're better and able to fully participate in activities, they can go back to school or childcare. That's an important sort of adaptation to where we are right now with Omicron in our communities. And the same goes for if Omicron's in the household. It's often very difficult to tell if it came in an asymptomatic child or if the child was exposed. We need to do our best for somebody who's tested positive. If you test positive, then the 5-day period of isolation. But if you have mild illness and not tested, it goes for all of us right now that we can go back to activities when the symptoms are resolving and we're fully able to participate in our normal day-to-day activities.
John, do you have a follow-up?
Yes, I do, and I'll also just ask for these answers in French at the end. Dr. Henry, what are you hearing about when booster doses will be approved for kids 12 to 17 in Canada? Many teens are quickly approaching that 6-month anniversary of their second dose.
Yeah, so whether a booster dose is actually needed in 12 to 17-year-olds is something that's still under active discussion. I know the U.S. FDA approved it, and they have a different process than we do, and they approved it for children, so the question is out there. Many other countries have been looking at the data and not made a decision about whether booster doses are actually needed for most children. I will tell you that the National Advisory Committee on Immunization is actively looking at the data on that question. We had some discussions this week, and there's more next week. So we'll have more to say about that probably end of next week or early the week after.